Pinch yourself. This is not a dream. It's the first proper week of spring. And after the long Nordic winter, people are out in the parks, mixing, mingling.
I work as a midwife at the hospital here in Stockholm. I just came from my night shift, so I woke up quite recently, and it's such a freedom to just be able to be here at the open field and with the sun, the blue sky, and the wind, just to clean your mind a little bit.
Stockholm feels like a parallel universe, where life, as we all once knew it, continues as if unchanged.
I think there have been a huge overreaction in most countries around the globe. They're doing the wrong thing. That's what I think. They should be doing more like Sweden does.
Government advice is this: keep your distance, and if you feel sick, stay at home. The priority, to protect the elderly and the vulnerable. But otherwise, Swedes are free to do almost all the normal things that, to an outsider, now feel dangerous. Subversive, even. There is a bit more nuance to this than meets the eye at first. Yes, a lot of the cafes and restaurants are open, but they have taken measures. It's table service only. They're leaving big gaps between the tables. One guy I just spoke to said, yeah, I'll come out for a drink. Yes, I'm going to work during the day, but I wouldn't go and see my grandmother. Swedes have been told to be careful about their social interactions, and it looks like lots of them have been taking that very, very seriously. This city is much quieter than it would usually be. Here's how social distancing works in the lunch queue at primary school. It's more an aspiration than a rule. They've taken other measures too, spacing out the desks, avoiding activities with too many kids together. Schools in Sweden are not just open, attendance is compulsory for children up to the age of 16. For the head teacher at this school, an immigrant from the Philippines, it's been a challenge.
I think it's the worries actually from the parents, I would say. But then when they have seen that I actually make sure that I follow recommendations from the health authorities, I mean, they accepted that. And I think it's actually rooted in the culture, you know, that's something that I've actually noticed, that when it comes to trust and respect, it's quite as solid in Sweden.
Trust is at the heart of the Swedish strategy. Social distancing measures are requested, not dictated. And in return, most citizens, more than 75%, according to a recent poll, have faith in the authorities' approach. So this is the Public Health Agency of Sweden. This is where Sweden's coronavirus policy is made. Anders, I'm Gabriel. The man leading that strategy doesn't talk explicitly in terms of herd immunity, but that is effectively the plan. Anders, I spoke to you, I think, about 3 weeks ago, and I said, are you sure you're taking the right approach? And you said, come back to me in a few weeks' time. So how are you feeling now?
I think to great parts we have been able to achieve what we set out to achieve. I mean, Swedish healthcare keeps on working, basically with a lot of stress, but not in a way that they turn patients away. What has not worked out very well is our death toll. And that's very much, I mean, it's partly due to the strategy, but not really very much. It's mainly due to that our elderly, or homes for elderly, have not been able to keep the disease out. So the deaths is obviously one of the key things where you want to get a good outcome. Is there a part of you that is thinking, have we got the right strategy here? Yes, of course, always there is, but still, almost 50% of the deaths takes place in elderly care. From our point of view, it does not disqualify our strategy as a whole. If you are basing your decisions on different data from the rest of the world,
What is the data that you are basing your decisions on?
But I think the question is, what data does the rest of the world base their decisions on? I think that's just as relevant. And we've been looking around, and there's very few things around that. There is the report from Imperial, a non-peer-reviewed report. That's one of the few things that you can find. And in most countries, you find nothing.
The outbreak in Sweden is concentrated in Stockholm, but there are big variations by district.
I think it's a little bit weird that we're moving around and not taking proper precautions.
Here in Rinkeby, where the overwhelming majority is from an immigrant background, the number of recorded cases is almost 3 times the capital's average.
Vi har bara info. Ja, vill du ha? Nej, okay. Everybody comes by and would like a test. And because it says in the newspaper that they want to increase their testing capacity to 10,000 a week, but we haven't seen a single test yet. But everybody has these symptoms that last for weeks and weeks, so we can just assume that it's COVID-19.
Today, the Public Health Agency estimated that by the end of the month, a quarter of the capital's residents may have been infected with COVID-19. Progress towards herd immunity? Perhaps. But the truth is, no one knows the real numbers. I've spoken to a doctor who works with COVID patients at a hospital here. He didn't want to appear on camera, but he told me, "I'm afraid." He said, "There are so many things that we don't know about this virus. Why are they taking this risk? They're gambling with people's lives," he said, "and they're gambling with the lives of those who are trying to save lives." Now, others in the scientific community are coming forward to voice their concerns. One of those is Lena Einhorn, a virologist, one of 22 scientists who've signed a letter urging the government to change tack. She's self-isolating here in the countryside outside Stockholm. You comfortable there?
Yeah.
I'm going to be about here.
There are thousands of trials going on right now around the world for treatments. We're not talking vaccines. We're talking antiviral treatments. We're talking about the treatments of the devastating effects of the infection. Already, there are a couple of drugs that have showed very, very promising results in small trials. Within the next few weeks and months, most likely, we will be able to lower the mortality. That, to me, is the most important reason to push this epidemic in front of you as far as you can.
These people who are deciding this, they're not politicians, they're scientists, like you.
Yes, it's just the problem is that scientists are people. And, you know, scientists have ideas that they cling to. You would be surprised how much science is not only ruled by rationality, it's ruled by feelings to a very large extent.
Compared to Sweden's neighbours, the numbers don't look good. Deaths from COVID here are 3 times higher than in Denmark and 6 times those of Norway and Finland. Those countries have imposed strict lockdowns.
I think it's too early also to say is a lockdown good or bad, because many countries are now having a discussion within the political sector, but also in the whole society. Should we lift the restrictions? In what way? What will happen? That is not a debate in Sweden, and it's not something the government is preparing for. We are not lifting any restrictions for the moment.
But if you look at your numbers compared to your neighbours, Denmark, Norway, Finland, it looks bad. Per million in population, this is a direct comparison.
I don't fully agree with that, because how to have the statistics, but also where are we, in what kind of phase for the pandemic are we for the moment?
Do you think you're earlier? Do you think you're further along?
We're not sure about that, but that could be a fact, and I think it's too early to evaluate that now.
If lockdown is a treatment that's being trialled globally, then Sweden is the control group. This is not about going out and getting your hair done or meeting your mates down the pub. This is about whether the course the rest of the world is on is sustainable or even beneficial in the long term.
I don't think we'll have more deaths. Come back 1 year from now and I think we'll have the same proportion of deaths.
But this is a hunch?
It's likely. I mean, this is a virus.
That's a hell of a thing to base your hunch on.
Yes, maybe, but just wait a couple of months and the death toll in the UK will be going up compared to Sweden.
It will be some time before we know whether this hunch is proved right. For now, it does feel like a big gamble.
Sweden has one of the world's most controversial and closely watched coronavirus strategies. While most countries in Europe implemented near-total lockdowns, closing schools and non-essential businesses, in Sweden, people are still free to go about their daily lives. Schools, restaurants and cafes remain open. But has it been worth the risk? Despite the relaxed guidelines, the number of coronavirus-related deaths per million people is far lower in Sweden than here in the locked-down UK. It's even lower than Italy, Spain and France, which have been locked down even longer. It's worth noting Sweden is much earlier in its curve versus other European countries. The death figure could still explode in the coming weeks. This is the man behind the Swedish experiment, the country's state epidemiologist Anders Tegnell. Tegnell believes his approach will achieve herd immunity by exposing those less at risk to the virus and lessening the blow of a severe lockdown. The strategy's been a gamble by Sweden's public health agency.
This level of measures that we have in Sweden, there is no problem for us to keep it running for months. Closing schools, more stringent measures like that, closing borders. You cannot do that for months or years ahead, but what we're doing in Sweden we can continue to do for a long time, and I think that's going to prove to be very, very important in the long run.
The risk relies on trusting the Swedes to adhere to social distancing measures without being forced to, and so far the country's robust health and care service have been able to cope with the increased pressure. Polling suggests the government's approach was initially popular, but Tegnell is now facing fierce criticism. Even though Sweden's numbers appear good compared to the worst-hit countries in Europe, its approach isn't yet proven to work. Far more people in Sweden are dying than in neighbouring countries like Denmark, Norway and Finland. Most of these implemented lockdowns early to prevent the virus from taking hold. 1/3 of Sweden's deaths have been among the elderly, and critics have accused the country's public health agency of failing to protect those in care homes. In the long run, Sweden's approach to lockdown may prove advantageous for its economy, leaving it in a stronger position to bounce back. Its light touch could result in a relatively smaller economic contraction than the rest of Europe. It's too early to tell if the Swedish model's working and whether its gamble will pay off. The risk is huge, and the world is watching.
You know what? I think it's a mixture between Swedish people in general having extreme high confidence in the authorities and in its administration. For example, the vaccination program in Swedish is completely voluntary, yet 98% of the people do vaccinate their children, against different diseases, which is the numbers are a lot lower in the south of Europe, for example. So they're appealing, I guess, to the common sense of the people, and the Swedes have so far responded pretty well. There has been, the numbers of travels during the Easter holiday because the government said, please don't go anywhere if you don't really have to. So people would start saying, what does it mean? Maybe I have to see my friends or whatever. In the end, 90% of the travels in Sweden were actually stopped, or voluntarily. People refrained from going away, even though they had tickets, on the train or the boat or whatever. So it has worked quite well in that sense. Obviously more people die in Sweden than in the neighboring countries, because there have been lockdowns in schools and such in Denmark and in Norway and Finland, not to speak. So it's a bit mitigated, obviously the
people don't mind the higher death toll in Sweden.
Excuse me?
People don't mind the fact that there's a higher death toll than in neighboring countries in Sweden?
There is criticism as well, of course. I think it has been quite well explained, that this policy or this theory. Basically, what they are telling us is that this virus is here to stay. There is no way we can close down a society for up to 2 years, or how long it will take to get people to get the vaccine. So we will have to face it this way, and we will the most important thing is to protect the old, and people who are ill, who are in risk groups for different reasons. That has not worked so well. I mean, as in most countries in Europe, there have been a lot of cases in older people's homes, for example. So that's the big issue, and there is criticism, of course. Now, understanding that Stockholm, the region of Stockholm, will probably reach this famous herd immunity in May, end of May, encourages people, I think, to be cautious, but still not be, panicking, because it seems that on the other side of May, things might get easier because that many people will be immune in the capital area of Sweden. That in fact you can start moving around almost as usually, but it doesn't really help the old or the risk groups. We'll still have to protect them.
Before I turn to Anna Nemtsova, Chris Radicki, just a quick word. Who's right? Norway, which opted for confinement, or Sweden, which never opted for confinement?
Well, I was just looking at the numbers, not so much for Norway, but if you count the number of deaths per million people, the US, which now has a huge number of deaths, only has 152 per million. Sweden has 200 per million. It's had over 2,000 deaths, and it's got a pretty small population. So you're gambling essentially that there will be herd immunity. But the problem is, we don't know that there really is any significant immunity with this particular disease because it is so new. It could easily be a case where you get very brief immunity or virtually none. So in that case, this would have been not a great effort. And if you look at the UK, for instance, it's now got 276 dead per million, a total of 18,738 deaths. And that was the country that first started talking about herd immunity before finally they realized their entire healthcare system would be overwhelmed. So I think there's the idea of herd immunity is a great idea. I hope it works. If it doesn't, then a lot of people will have died.